Good morning, everyone, or good afternoon, depending where you are. Let's give us a couple of minutes just to let everyone in, and then we will start shortly. And thank you very much for attending this webinar. So while we are waiting for people to join, just a quick reminder how the translation is working for the francophone. Vous pouvez traduire en cliquant sur le globe en bas à droite, en bas de votre écran, et vous aurez la traduction en français. Pierluigi, for the Spanish.
Hola, buenos días. Sí, por todo lo que hablan español, pueden acceder a la traducción haciendo un clic en el icono del globo en la parte inferior de la pantalla.
Thank you very much, Pierluigi. Next. So as we say, welcome to this webinar on the use of cash for nutrition and what was the latest latest update. So, and lesson learned and talking about resource. So this webinar will last about 90 minutes and we are hoping you will learn a lot. Don't hesitate to ask questions using the Q&A box at the back of your screen. Next. So thank you to our generous donor and contributor that help us to make this webinar live. Next. So today we will start with a quick quiz just to have an idea of what you know or what you don't know about cash for nutrition outcome. And then there will be a presentation on the recently published frequently asked question on the use of CVA for nutrition outcome, along with another recent document, which is a nutrient sensitive minimum expenditure basket companion guide to use again CVA for nutrition outcome. This presentation will be followed by a panel of experts to share their experience on using these tools. And then we will have a very interesting case study from Myanmar, again, followed by a panel of experts to discuss the content of this case study, but also the way forward when it comes to using cash for nutrition outcome. And we will conclude and discuss the next step. Next. And now I am handing over to Pierluigi for quiz time. Thank you very much. Up to you, Pierluigi.
Yes, hi everybody. Thank you very much. So we will, as Diane was introducing, we will start with a quiz time. So please, we can launch the question. So you will have here, you will see 4 questions. You have about 5 minutes to answer. You should have access to the question. The first question is what are among the approaches listed the global approach that are being commonly used for integrating CVA for nutrition in response. This is a multiple choice question. The second question is if you think targeting household with wasted children with cash or voucher assistance can cause harm. This is a single choice question. The third question is, will conditional assistance be helpful to create a nutrition incentive for project beneficiary? Again, this is a single choice question. And the fourth question is, how might the value of cash or voucher assistance be calculated in CVA for nutrition project? So please take some time, read carefully, and you have 5 minutes to answer it. So just to say that the second, third, and fourth question will be also used to introduce some of our resource that our presenter will just present after the quiz. Give you 2 minutes more. One minute. Okay. Are we able to show the result, Miriam, on the pool? Okay, in terms of the first question, what among the following are a global approach for integrating CVA for nutrition response? 80% of the respondents say all the above, and actually is correct. And now I will go into show you soon the reason why. In terms of the second question, the most of the respondents say potentially evidence is very limited and mixed, and okay, I can see here the result. Okay, great. In terms of question one, see please, next slide. Yes, as most of you, and I'm happy to see this, almost 80% say all the major approach. In fact, all the five approach that were mentioned are correct. Those five approach are came and are part of a framework from evidence and guidance note on the use of CVA for nutrition outcome that I believe most of you already know, that was published some year ago by the GNC, and effectively we can use CVA for to support two main scope of and pillar of the nutrition. One to support the prevention to malnutrition by either supporting individual or household food intake. It can be also be associated in combination with SBC, and actually there is some emerging evidence in which is showing this approach as very effective in supporting the prevention of malnutrition, but it can also be used conditionally to improve the attendance of caregiver on and people with some or mom on preventing access to service. From the other side, CVA can be also used for treatment purpose. So again, to facilitate access to treatment of malnutrition, to treatment service, as I was mentioning before, but also to avoid, to mitigate or prevent, for example, relapse. As we have different type of initiative that are try to build evidence on the use of those approaches. As I was mentioning before, we have some growing evidence showing the use of CVA for prevention, but we still and it exists somehow a substantial gaps on the application and the evidence on the using of CVA for treatment, on the use for the management of wasting. And actually we will spoke also later on the the GNC, one of the objectives of the GNC is also to try to fill this gap. Okay, next slide. So congratulations to the majority of you of having answer correct. Next slide. So for the other solution, to question 2, I will just mention it briefly because after I will give the word to Marina and Jackie, which will be treated some of the question that has been highlighted. So in terms of targeting household with Western children with cash or voucher system causing harm, yes, this is potentially there is a mix of evidence showing this, and actually the evidence is very limited. So it's something that is not there is not a strong link on it. In terms of the conditionality on the use to use conditional CVA to incentivize attendance and nutrition incentive. Also, this and Marina will tell us is not. There is not a strong link. Particularly, we normally suggest whenever we want to put conditionality to use soft conditionality. And in terms of the question number 4, how we can calculate the value of cash of voucher assistance. Yes, all the tools and methods highlighted are somehow correct and can be used. And Jackie will explain later on. So saying that, thanks very much and congratulations. I think most of you have been really successful to answer properly the question. And I'm now giving the floor to Marina and then Jackie. Please, Marina, also feel free to introduce yourself and as well Jackie.
Thank you, Pierluigi. Thanks, everyone. I am Marina Tripaldi, Senior Cash and Voucher Advisor with Save the Children International, one of the co-chair of the CVA for Nutrition working group under the Nutrition Cluster, collaborating this here with Pierluigi a lot as well, that has covered my role. I would like to start by saying that the frequently asked question, it's a document that was published in 2023, really with the purpose of providing a very short and user-friendly document that was to support practitioners, both on the CVA and on the nutrition side, to tackle some of these key questions that sometimes are controversial or didn't have a clear answer. We wanted to have a product that was reflecting the view of the group. We worked with the Key Consulting to develop a first draft, but we went also through the revision of the existing literature, and we collected the feedback from experts, key informants, and most importantly, from the members of the group, to really make sure that we were trying to provide answers that were reflecting the view of the group. There are some animations, so you can click and they're gonna count exactly. So as I was saying, the target audience is really CVA and nutrition practitioners, and everyone that wants to use cash or voucher modalities for a nutrition program. Next slide, please. So the document includes 6 questions that provide some considerations and recommendation on 6 topics. The first one is targeting. You can click on. The targeting, for the targeting, we talk about what can be the target group, if to target individuals or households, what can be the eligibility criteria. We really want to explain how different and for many different purposes the target can be, and the importance of linking the choice of the target group to the objective of the project. Obviously, when we want to provide cash or voucher for prevention, we would target like the wider group of people exposed to the risk of malnutrition, while when we use the CVA for a curative purpose, we would target wasted children or pregnant and breastfeeding women. And we explain really step by step how to link these more categorical targeting or targeting based on the eligibility criteria with what is relevant for CVA, so with poverty, food insecurity, all these different barriers, financial barriers to malnutrition. The second topic is the transfer value. So many different methodologies to calculate the CVA transfer value. Again, it's very important to link the calculation of the transfer value, cash or voucher, to the objective of the program. So we provide some considerations on how to do when we want to provide just food to the household, when we want to provide nutritious food to the households and or the individuals, and what to do when we want to provide the transfer value to access to health services. Next. One question really tackled the issue of how CVA can be used to influence the use of cash and voucher for a nutrition purpose. And we explain how the combination of CVA with social and behavioral change intervention has been successful in influencing spending decisions for nutrition. We provide some lessons learned in what has worked and what has been challenging. The fifth question relates to the use of conditionalities and how conditionalities can be incentive for the target group to attend a specific health service or a nutrition service. We provide some considerations on the use of conditionalities. There is a growing use of conditionalities in the health sector, but there is also evidence on how conditionalities can be harmful for our target group, evidence from Save the Children, evidence from UN Women, showing how on the protection side, for instance, asking to vulnerable women to attend a specific activity as an obligation can create some protection concerns, like leaving children at home, and other type of concerns. And there is an aspect also related to cost efficiency, because when we use conditionalities, we need to monitor. The effectiveness, the attendance of the activities. So we reduce the effectiveness of the use of cash. The last question relates to monitoring and evaluation. We provide some considerations on how to have a monitoring and evaluation system when we combine the two programs, and we require a set of skills, both on the CVA side and on the nutrition side. What can be the challenges, what we would suggest to do. And we provide a menu of indicators. Again, we highlight how important it is to link the choice of the indicators to the objective of the project. So the menu of indicators should not be used as a comprehensive list, but as a list of indicators that can be picked if we want to design a program that is integrating health or integrating WASH as key interventions identified as solutions to a problem that exists in a certain community. So very important to not to include too many indicators, but only those that are relevant. Next slide, please. So this is a short summary of the content. More information about the document itself are available on the link that I'm going to paste on the chat box in a minute. At the moment, we have an English version available, but Spanish, French, and Arabic version are about to be finalized. So please watch the GNC website as they will be available soon. And that's all from me. I think I'm going to pass it over to Jackie now.
Thank you, Marina. Good morning, good afternoon, and good evening. It is fantastic to see so many people online on the call today. So Marina has just gone through the frequently asked questions, which is this technical document that helps us through the project cycle, so you can understand how do we factor in the cash and voucher assistance in our nutrition work. I'm now going to present a second tool that we've developed as a team, but this is from a non-nutritionist perspective. It's about the minimum expenditure basket, which many of you have probably heard of. It's a tool that's been used to calculate expenses as a proxy indicator for needs in humanitarian contexts. The guidance exists, it's hundreds of pages long, and what's happened is that over the last year, sector-specific companion guidance have been developed. So nutrition is one of many. There's also a shelter one, a WASH one, and the NFI and the other sectors. So I'll just highlight a few of the interesting things of this guidance. One, it is a companion. So as a nutritionist on the call, or if you're CVA experts on the call, this is for all of you. It's aimed at both the nutrition and public health experts, as well as cash practitioners, whether they're in cash working groups, coordinating, or whether they're designing multi-purpose cash transfers. And secondly, it's only 6 pages long. So it's just trying to be the minimum guidance to help you figure out how to monetize the components of a cash transfer that could help with nutrition outcomes. Next slide, please. So often the two groups, what we're trying to do with this guidance and what CALP, who financed this piece of work, was trying to do was get more nutritionists involved in the cash working groups at global level and country levels, and for the cash working groups to be more sensitive to what nutritionists mean when they talk about nutritious diets. So I just listed a few questions here. Nutritionists, we often say to ourselves, but isn't nutrition a basic need? Shouldn't we adding the cost of a nutritious diet to an MEB? Which nutrition needs can be monetized? You can't find all the nutritious foods in all the markets. You can't, can we monetize access to healthcare? Transport, is that one of them? So what are others doing? We're often learning from each other. What are they doing in Myanmar? What are they doing in Northwest Syria? What are they doing in other countries? And how do I navigate all the CVA jargon? Next slide, please. So these are operational levels. And this 6-page tool, which we're encouraging you to read, is going to sort of walk you through the project cycle in the same way and more or less tell you how to introduce nutrition sensitivity. For food baskets, so that means how do you look at the basic food basket that's normally considered an MEB, and what you need to do to have a nutritious diet, which is often more costly, and is that a sector-specific objective, and therefore does it need to be calculated as a top-up to a multi-purpose cash? It will also help you how to inform the composition of a nutritious diet and its price, and there are various tools for that, Nutbal, the cost of the diet, and fill the nutrient gap, among others, and that was one of the questions that came up today. And then it will also help you, remind you that you have to identify the nutrition gap. You actually have to understand the population that you're trying to support and find out what is it that's missing, how much more do they need, and how will a cash or voucher assistance help towards that. and then help you see whether a generic or a sector-specific cash transfer is needed. So it's a practical guide. It's only 6 pages, and hopefully it will help the nutrition experts and the cash working group experts work more closely together and be more aware of each other's way of interpreting needs. Next slide, please. You can look at the guidance itself. These are the two main websites to look at, and if you've not ever looked at a real full MEB guidance, that's also included there. I've put it in the chat for you as well. And I think that's all I'd like to say today. Thank you.
Thank you very much, Jackie. Thank you very much to Jackie and to Marina for this great presentation. Lani, can you step back, please? Before we move to the Myanmar case study, we're gonna welcome 2 great panelists, Mabasa and Mirko, that kindly agree to participate. So Mabasa has more than, if you don't mind putting your video on, Mabasa has more than 15 years of national international experience in Southeast Asia, Horn of Africa, East Africa, Southern Africa, in cluster coordination, program management, planning, implementation, monitoring, and evaluation in developing country, complex emergency post-conflict zone. It's quite the experienced guy, and very important, he's currently the Nutrient Cluster Coordinator in Myanmar since 2022, and has seen incremental progress in meeting humanitarian needs in country despite the current conditions. So Mabasa will be one of our panelists, and our second panelist is Mirko Tomasi, if you don't mind putting your video on. Is a West and Central African regional representative at the CALC network, and where he leads different initiatives on cash and voucher assistance. He has more than 15 years of humanitarian development work, and Mirko has engaged in CVA in fragile setting, linking between humanitarian CVA, social protection, and other area related to CVA. And in the past, he also worked in the implementation of CVA program for nutrition, mainly in Africa. So thank you, gentlemen, for being with us. So my first question will be for Mabasa. Mabasa, we just saw a presentation on how to consider, what to consider in to make the transfer value more nutrition sensitive. Can you share maybe some of the experience you had and what has been working well, and most important, what have been the barrier and challenge you face, and you overcome this barrier? Mabasa, the floor is yours.
Thank you very much for the question. I think we've had quite some groundbreaking experiences in Myanmar. To some extent, in relation to CVA in nutrition, and we are grateful that we also get shepherded by the global team of experts around cash voucher assistance in nutrition, and to that extent, we actually are among maybe few countries, if I can say, with a cash voucher assistance guideline that has been put together, again with support technically, financially as well from the global colleagues. Now, in terms of making sure that the transfer values are sensitive or are fit for purpose, we've had to make use of the technical expertise both in country and outside through the CVA task force to make use of the survival minimum expenditure basket, food values in setting transfer values, which at least meet the energy and nutritional needs of those that would have been targeted, that is children, for instance, with either mom or some or moderate acute malnutrition or severe acute malnutrition, if you like. And apparently, Myanmar is quite a diverse country, and currently the task force is looking towards, again, looking at this minimum expenditure basket and have many more foods that are diverse, also to fit the diverse nature of the country, to be able to come up with minimum expenditure baskets that are fit for purpose in a sense, or that are relevant to one region or the other. I think there's quite some CVA related experience and expertise in the country, one of which is also that previously the cost of the diet was actually being used to try and establish the needs, albeit for children below 2 years. So this is basically how the country has geared itself up for making sure that the nutrition sensitivities in the transfer values are actually taken care of. Now, I would move on to the successes that we can sort of like boast of in Myanmar. Prior to the crisis that has affected the whole country, this had basically been adopted across the country. That is the CVA, that had also an SPCC component to it. And for your information, quite some very important peer-reviewed body of evidence has been done in Myanmar to try and prove that CVA, for it to be impactful, would need to have SPCC done along with it. I will lastly talk about the challenges that have been faced in this current setup, or in this current regime of CVA undertakings that are, of course, guided by the guideline, like I've already mentioned. Myanmar is going through quite a lot of challenges in terms of conflict, concomitant displacement, and also a humanitarian situation that has become protracted. And because of that, there are cash issues that are being experienced because of liquidity issues, hyperinflation. The macroeconomic environment there is quite a challenge. And as a result, there's an absent formal way of making sure that the funds are transferred to beneficiaries. And hence, there's what is called a hundi transfer system that basically costs a leg and an arm. And this is one very serious challenge that is being faced. There's also been challenges leading to collapse of the health system, and hence that also complicates everything that we're talking about in terms of CVA. There have been restrictions in terms of importation of important therapeutic foods, and also that has, in a way, meant that CVA needs to be expanded, but the flip side of it is also the cash transfer issues and challenges that I've already mentioned. Quite a number of strategies have been overcome in trying to overcome this. We try to coordinate our partners and also seek quite some technical expertise from colleagues in country and outside, and work very closely with the cash working group for expertise. We also have started to make use of these transfers through some less formal means as a way of dealing with the challenges that are being experienced. So basically, those are some of the challenges and the way they are being overcome. And obviously, we've also undertaken issues around trying to strengthen the partners through a lot of capacity building, and we continue to, as a cluster, seek support and continuous improvement from the global experts who are always ready to come to our rescue as and when we need that. Thank you very much, and over to you.
Thank you very much, Mabasa. Always happy to help, and always nice to hear what you're doing. And we're going to hear a bit more from Sleep on what has been done in Myanmar recently. Now, Mirko, I have a question for you. As I say, you are the king of cash in Western and Central Africa with some experience in cash for nutrition. What would you say? What advice would you give to nutritionists that comes to you and say, I want to do cash, but how can I make sure that the cash will have an impact on my nutrition outcome?
Thank you, Diana, and thank you for having me here today. I'm going to give a few advices that I think from my experience and also from the work that we do at the region and globally. So my first advice to all nutrition practitioners would be to participate in the coordination of cash working groups. So in order to have a good understanding of what is being planned or implemented at a specific country level in terms of CVA. So here I mentioned with what specific project is ongoing or planned, what are the beneficiaries, how they are targeted, who are the actors that are implementing these programs. This participation in the coordination would allow also to the nutrition practitioner to identify opportunities for collaboration and to understand also the way of working of a CVA practitioner. When appropriate and where it is also possible within the coordination, as a nutrition practitioner, you can also use this space to advocate with agency planning or implementing CVAs in order to have a specific nutrition component incorporated also in other more broadly CVA programs. A second point that I would like to mention is the contribution to the MEB. It has been touched briefly earlier. So I would suggest really to contribute to the MEB development and review so that all the nutrition components are well included in the MEB. All the requirements are included. So you can also participate and you can also support the cash working group with specific technical support on nutrition. That is, it's not always present within the other actors that are at the cash working group. Even though you have to be aware, and also you will become aware in the cash working group discussion on the limited funds that might also be available within the CVA, so that it helps the discussion to try to prioritize. Another point for me it's very important also is the complementarity with the CVA programs that are not nutrition specific. So try to explore option of complementarity with other organization. Try to combine the programs of our other organizations in order to complement and have a better nutritional outcome in terms of calculation of transfer value, targeting criteria, and other things. And lastly, I would suggest also to all nutrition practitioners that are willing to engage more on the cash working groups discussion and also on the MEB works, maybe to undertake some basic CVA training, and you will find some of them in the CALP network website. It helps you to understand, to be more familiar with the CVA terminology so that you can participate more actively in those discussions. I think it's over for me at the moment.
Thank you. There was a lot of very great advice. And I would like to come back to your comment on MEB. When you look at the nutrition sensitive MEB, you can see that there's two main challenges. The first one is the data, the type of data you need to collect. That could take a lot of time if you are considering all the aspects pertinent to nutrition. And the second one is the affordability gap. Mostly if you really want to match all the nutrition need of a family, often it will not be financially possible. So what advice would you suggest to afford these two challenges, data collection, data analysis, and making sure that you reach the best, you get the best transfer, the best nutrient sensitive MEB, but at the same time looking at what you can afford?
Yes, thank you, Diana. It's a challenging question also for us, I think, but I try to also provide some at least some reflection in order to understand how to position as nutrition specialist. First, I want to say that also the MEB as it is it's not sufficient as to respond to or to ensure the nutrition outcomes for the different contexts. However, I think it is essential that in the MEB there are included all the nutrition components so that it can help a practitioner. I think you mentioned about the funding, the situation. First of all, it's not only related to nutrition. It's not related. It's a big issue that all the humanitarian sector is facing today. So it's I would suggest on that to try to be pragmatism. So try to balance the efforts that you would like or you can put into this process. With the likelihood of having more impacts. And I think it is very important to participate in the process, to seeking complementarity as well, to see what work can be done in complement to others more general CVA intervention, and see what is the added value that is adding to the nutrition outcome. Always in the value, I would help organization to try to reflect on the value that they have in processing in participating in the MEB development and the revision. First, consider the fact that participating in this process might help you to increase the relations with other stakeholders doing CVA and with also other sectoral practitioners, and can also help you to try to influence, leverage, and create awareness on the specific nutrition needs. And finally, I would suggest to reflect on the visibility and the advocacy. So of having a complete MEB also with the nutrition specificity, and saying that having it helps for sure to keep it in the agenda, because we know that once we develop MEB, usually it's a tool that stays for some years. And when we have some section on it on the revision, we tend to keep the section, so it helps to maintain also a nutrition within the MEB in the long run. And also on the fact that we know that there are some uncertainty in funds today. It's clear, but we do not know what is going to be for tomorrow. So having an MEB, including the nutrition section, it might be a future opportunity because if there will be more funding in the future, it's already there. It can be used. And lastly, maybe a last point is that participating in MEB, even though it's requiring energy, but it's also providing added value, and also it allows you to understand the added value and the limitation of the tool, and also eventually also participate in the future revision of the tool as it is, and maybe also to complete it with additional tools. I hope that I'll help some reflection. Thank you.
Thank you very much. I hear what I'm hearing is the importance of working together and designing an MEB with the hope of getting the most funding possible, not going for low MEB, but rather high MEB with the hope that there will be more funding. Mabasa, do you want to add anything based on your experience, or how did you what tool you use for the estimation of the MEB, but also if you were able to provide some strong advocacy for more funding to make sure that the nutrition sensitive MEB match with the available funding, or rather the funding match with the nutrition sensitive MEB.
I think I would just comment briefly on the funding side. I think we've not been that fortunate to have quite some optimal funding arrangements given the environment we've tried to create to make sure that a CVA gets implemented. I think I also want to mention that we came to a position where we had to explore our options to reach out to hard to reach communities. And of course, CVA became one such opportunity, but unfortunately, the funding has not been forthcoming. But fortunately, Myanmar is an HNO HRP country, and sometimes we do get some Myanmar humanitarian funds, part of the country-based pooled funds that are given to partners. And some of those funds have had to be repurposed for CVA because in some instances, those funds could not be utilized for what they had been intended for initially. So we have had a fallback plan to repurpose them for CVA, and that has been quite a success. So we continue to cry out there like anybody else for funding for our CVA undertaking. But I think in terms of trying to make sure that there's sensitivity in terms of the minimum expenditure baskets, I think this is quite some work in progress for us. And for now, we think the little that we have put together has been quite helpful in meeting the needs of those stricken children. Thank you very much, and over to you.
Thank you, Mabasa. And we have to remember that all these tools have been recently published, so we are all learning as we go. Thank you again, Mirko and Mabasa, for your input, your great input. And for everyone else, do not hesitate to ask your question using the Q&A. The slide will be shared as usual for any GNC webinar. And so Mabasa Wanyansa shares experience from Myanmar. So I think it's a great way to move forward. And for me to introduce you to Slim, who's our senior nutrition advisor for Save the Children. But most important, is also the co-chair of the Myanmar Nutrition CVA Task Force. So he's been really, really involved in all things linked to cash for nutrition. He holds a MSc in nutrition and dietetics and brings over a decade of experience in public health nutrition and a lot of experience in providing technical leadership and developing high quality nutrition programs. So Slin has kindly agreed, despite the late hours in Myanmar, to share the experience of the nutrition cluster in Myanmar on how to use CVA for and SBC for some children and mom children. So Slim, up to you. Thank you very much.
Thank you, Diane. Thank you, everyone. Firstly, I would like to thank you to the webinar organizer to invite Myanmar experience to share about CVA and SBC on IMER. So I will be kind of representing Myanmar Nutrition CVA Task Force generally. This task force is chaired by Save the Children and WFP and hosted by the UNICEF. Thank you. Next slide, please. Yeah, before I'm going through the detail about our CVA experience targeted Myanmar, I just quickly explain about our Myanmar CVA use case. Actually, these CVA use case are adapted from the global guidance. Generally, in the global guidance, you will see like 5 use case, but for us, we have adapted and agreed to use as a 5 CVA use case. For the use case number 1 is more about the prevention, CVA to increase access to the nutrition diet to enhance growth and prevent deterioration of the nutrition status. For the use case number 2, it is kind of CVA to facilitate access to preventive health services, more like for the healthcare services. For the use case number 3, it's generally for the mom children, so to facilitate access to nutrition services for the mom children. And for the use case number 4, is kind of to facilitate access to the nutrition services for the some children to improve nutrition outcomes and prevent relapse. So generally, we have only CVA use case, but in terms of CVA intervention, we have like 16 interventions. So it is really difficult to intervene all CVA intervention with the current situation, as Ali mentioned, because we have limited funding in the humanitarian response to implement all the use case, and the capacity and experience of the nutrition partner to applying all the use case is also a question for our country. And I think one of the big reason is because of the current political context. We have a lot of restriction on the movement and transportation of the IUDF and other nutrition commodity. So after looking at this factor, we have kind of come up with the key CVA intervention we will be prioritizing in this year. So that's why we have come up with CVA targeting minority children, and which is in terms of feasible, in terms of funding, and the feasibility. Yes. Next slide, please. Yeah. In this slide, I will be sharing about the overview of the two CVA intervention which targets minority children and family. So out of the 40 CVA intervention, the two CVA intervention we target to the both son and man children. So the first CVA intervention, what we call is CVA for household assistant combined with social behavior change intervention. So for that, we are targeting, for the CVA intervention, we are targeting household level with children aged 0 to 59 who are admitted in the IMAN treatment center. So another CVA intervention, what we implement is CVA top-up for some cure follow-up. For that CVA intervention, our target group is individual level, who is kind of targeted to the children. Next slide, please. Yeah, I would like to go a bit more detail how we determine the targeted beneficiary with our process. And the very first and important thing is as a nutrition cluster and CVA nutrition task force, we always work with our partner and always listen the voice of the partner. So we have our partner also raised that the need of CVA intervention for the son and man children. One of the main reasons that the partner raised that CVA intervention because of the IUDF and IUSF stop up and restriction across most of the area, most of the area in the country. So based on that need, we discussed and agreed different options among the CVA nutrition task force member. So one of the factors that we consider when we are discussing about targeting son and man family is kind of protection principle to make sure we are not making no harm to the family by providing the CVA and collaborating with other multiple interventions. In addition, when we are targeting the CVA for the son and man children, we also need to collaborate with the nutrition cluster, especially the IMAN technical working groups, to make sure that we exactly follow the integrated management of acute malnutrition treatment guideline. So for that, some of the key factors we have considered and helpful for us to decide is the GNC technical alliance guidance on the complementary measure to manage the time wasting during the temporary shortage of SNF. And then which is also quite useful when we are deciding this CVA for the son and man children. Another guidance note is the recent ratio guidance note on CVA targeting son and man, which might also contribute to the better outcome of the nutrition program. So yeah, these are the kind of key factor we consider when we are targeting the son and man children. Next slide, please. Yes, yeah, and this is the process how we determine transfer value when we are targeting son and man children and family. I would say the very first step, what we look at is we try to understand the cost of the diet of the individual that we are targeting. And then we try to understand the percent of the household spent on the food out of the cost of the diet to the cost of the diet value. And then we try to understand the percent of food security assistance on the food. And then the remaining is kind of the gap that we should design as our transfer value. This is kind of our concept and idea that we would like that when we are designing the transfer value. But for the version 1 SOP, we are quite rushed because most of the partners, they would like to implement CVA ASAP because of the IUDF shortage. So for the current version 1, we try to apply the SMEB. Generally, we choose SMEB because SMEB, we have SMEB values across the country, different regions and states. So based on that, we refer the existing available cost of the diet, especially available SMEB value. For the SMEB value, kind of the food ration is 65%, but it is only energy need or the targeted beneficiary, and the remaining 35% is kind of non-food value. So for that, we refer SMEB. But We also try to look at other, possible tool when we are deciding nutrition sensitive transfer value, for example, cost of the diet. And in the last kind of 4 or 5 years ago, when Myanmar has the MCCT, targeted mother and children cash transfer, we were able to refer to the cost of the diet. At the time, the country is quite stable and we can apply it across the country. But for the time being, it's not possible to do the cost of diet in different areas of the country, and the context is also doesn't allow to do so. That's why we use the existing SME survival minimum expenditure basket as our kind of reference when we are deciding the transfer value. I mean, we know this SMEB is not, very nutrition sensitive, but kind of at least meets the energy need of the children. But in the version 2, we are in progress to make sure that I'm referring, because recently the cash working group, they also updated the MEB value. So where we able to refer that nutrition sensitive MEB value when we are deciding transfer value for the version 2. Thank you. Next slide, please. Yes, yeah, this is kind of a part of the transfer value. Generally, I just would like to explain you to understand a little bit. Generally, in the malnutrition treatment program, we provide cash CVA when the child is admitted to the treatment program. So when the child is admitted to the treatment program, our target is to the household member. So that's why generally in our country, every household size is like 5 households. So in that period, we provide the SME value for the 5 household member. So this is kind of our transfer value when the child is admitted to the treatment center. But after discharge from the IMAN program, we also provide as a CVA top-up for the some cure follow-up. So for that some cure follow-up, we only provide to that individual children. So generally, the individual food ration for the SMEB is $10. And for if it's kind of for family, it will be like around $50. Yes, next slide, please. Yeah, this is kind of, I just would like to share our experience how we determine the transfer duration. So generally, when we are deciding study this CVA for the STEM and MAN children, we closely collaborate with the cash working groups and IMAN technical working groups. So we exactly follow the IMAN treatment guideline. So during if the child is kind of a very severe acute malnutrition with complication, the child need to admit to the inpatient therapeutic treatment center, ITP. Generally in the ITP, the child have to stay like maximum 60 days, and then he or she will move to the OTP like 45 days. So treatment duration at the treatment center for some children with complication is today around 2 months. So that for that 2 months, we provide the household CVA to the other family member. And then after 2 months, the child will be discharged from the OTP. And then we provide some cure follow-up 4 months to that targeted individual level. And for the OTP, the same. Generally, outpatient OTP and duration is kind of 45 days. For that, we provide 1 CVA for the household, and then follow up 4 months CVA for individual targeted to the child. For the MAM children, moderate acute malnutrition children, we provide targeted supplementary feed program. Generally, it's kind of 90 days, but as we are providing the household value, which is kind of 5 times then individual value, so we can only provide the 1 month to the MAM children. This is kind of what we have agreed and suggested among our DWG member. Next slide, please. Yeah, this is kind of our process to determine the SPC. So I will firstly explain about the rationale. So as a nutrition CVA task force, we try to look at the evidence along globally and regionally. The first thing we look at is the global evidence on the cash flow SPC for the better nutrition outcome. They are evident from the globally and regionally, like Togo, Nigeria, Bangladesh, but the evidence are more for the standing. So we also try to look at our Myanmar experience. So Myanmar SCN experience from Legacy RCT 2019 also found that CVA complemented with SPC, it lead to 4.4 percentage point decrease in study and 2.8 percentage point reduction in the moderate wasting. And Myanmar IMM protocol also mentioned that SPC counseling as one of the key principles for the treatment of the man. That's why we decided and agreed to make sure that SPC attached in our CVA transfer. So the process. So when we are deciding about the CVA for the different partner, I mean, ideally, the full comprehensive SPC is our preferable option, but we have different partner with different experience. So we have to consider the feasibility. So among the different layout SPC intervention, like social ecological model from the onion model, so we, in this SPC for CVA, we target more for the family member, which is like enamel layout, the SPC and minimums formative research. In addition, cookie demonstration was also mentioned as one of the complementary action in the external IUTF, and which is quite effective. So that's why we also integrated as part of the SPC when we are introducing CVA to the family. So this is kind of mandatory. And finally, so we added as kind of community capacity strengthening to reduce the relapse and recurrence of some cases. So we trained family members how to use the family unit, and family member can monitor their own. I mean, when they are discharged from the treatment program. Yeah, this is kind of key minimum recommended SPC that we recommended in our CVA for Salmon children. Next slide, please. Yeah, in the next slide, I will be talking our challenges, experience. It will be my final slide about our experience when we are developing and implementing SOP. Oh no, yeah. So the operationalization by the key implementation partner. So generally, we have developed the SOP, I would say less than a year, but we have already some partner implemented the CVA for Salmon Manchurian, some of the partner in the Rakhine, you will see in the map, the green color, and some of the partner in the KR, and some of the partner Bago, Cayenne. So 4 regions already implemented the CVA for Salmon Manchurian by using flexible use from the Myanmar Humanitarian Fund, and some of the partner use their own specific donor fund like the VHA and the USA is one of the key donor. So CVA has also been included in the 2025 humanitarian needs and response plan by the nutrition cluster. So these are kind of operationalizations by our key partner regarding the CVA for Salmon Man. So we are still learning. So we also get technical support from the global nutrition cluster in the future step. Next slide, please. Yeah, this is kind of my final slide regarding challenges and the lesson learned. So I would like to explain first the challenges, as we also already discussed and heard earlier, the funding and support from the key donor, which is really important when we are developing the CVA. And the other factor is kind of limited with the current context. We have inflation, the lack of access for the money money transfer. So that's why we try to use this Conti for the CVA transfer. As our CVA intervention need to link with the IMM program. So we have one of the difficulty is the limited number of IMM program across the country and the functionality of the IMM services. The key lesson learned include we nutrition cluster has drafted the advocacy note to mobilize the resources to support the CVA need in Myanmar. And the most important thing, collaboration with the cash working group and the CVA partner is really important for the harmonization and steady transfer value, and collaboration with the IMNWG and the healthcare provider, which is also really important for the successful implementation. And finally, is kind of provide capacity building opportunity for the nutrition partner regarding the CVA and MEB. Yeah, and this is our kind of challenge and listener. So thank you so much for the opportunity. What do you think?
Thank you so much, Slim, and thank you again. I know it's very late in your place. I saw a couple of Q&A before. Please do not hesitate to ask your question using the Q&A box. And I would like to invite now 3 wonderful ladies to come and participate to our panel. So we have, and if you don't mind putting your video on, first we have Maggie. Do not ask me to say your family name. I never managed to do it. And she's a USAID lady. She works for she's a nutrition advisor for the USAID Bureau for Humanitarian Assistance, BHA, and she's covering a global portfolio of emergency response. She's also an expert on the use of CVA for nutrition, and pet-based is focused on appropriate calibration of transfer value models for adequate nutrition coverage, meaning she's a queen of MEB and transfer value. And we will also have Annalise Borel from UNICEF that comes with more than 30 years of work experience in nutrition, food security, livelihood, working in Africa, Balkans, Europe, Middle East, South Asia. And she had a lot of senior leadership position with the UN, the donor, Red Cross, NGO, and government, also working mostly in countries affected by fragility, crisis, and development. And Annalise is currently the senior advisor for nutrition and social protection with UNICEF, and she's focusing on effort to ensure that social protection system and other systems are leveraged to be impactful on maternal and child nutrition outcome, including the prevention of malnutrition. So she's a queen of social protection and nutrition. And last but not least, we got Ines Lezama, who's our nutrition cluster coordinator for Ethiopia. And job is to lead effort towards to coordinate nutritional emergency response for millions of children and women. And key achievements are enhanced and increased by the number of nutrition assessment and analysis, led advocacy effort for scale-up nutrition response, and promoted local solution and data-driven approaches to better understand and address nutritional need. And finally, enhanced effort for having CVA for nutrition outcome guidelines in Ethiopia and for extending the response using CVA. As a reminder, the nutrition cluster in Ethiopia has recently published a guidance on how to use CVA for nutrition outcome, and Ines has been really involved in it. So thank you, ladies. So my first question will be for Maggie. So Maggie, we talk about this nutrition sensitive MEB. We talk about the FAQ. There's a lot of guidance being published by different countries. So a lot of things coming up. What do you see as the most influential or promising recent shift in the usage of CVA for nutrition outcome?
Thank you so much, Deanne. So I think in terms of the influence of this community right now in the conversation that we're having and some of the shifts that I'm seeing, there are three important things that I would like to highlight. The first is that I see a real recognition of the value of sectoral cash. For some years, I think that we were, trying to sort of combine sectoral directional outcomes into MEBs, which are intentionally generalized to the household. And so it's been incredibly helpful to see nutrition cluster coordinators in different countries across the world, especially in the emergency space, saying, hey, maybe we need to consider thinking about this a little bit more specifically and using a sectoral cash transfer instead of just trying to get our needs met inside of the MEB. Because often, if MEBs or SMEBs aren't really fully funded or don't have great coverage, then you end up losing out on those nutrition outcomes. And so I think sort of separating out cash for nutrition into sectoral cash has been incredibly important in getting more visibility on it and in being very, very targeted in the way that those outcomes can happen. The second area that I'm seeing a lot of progress in is that I'm seeing in the way that these guidance documents, the country level guidance documents have been written, is that there's a real operationalization of this concept of use cases. So when you're talking about cash for nutrition, it's not just one big sort of type of transfer, right? There's many ways that you can use cash or voucher transfers to affect nutritional outcomes. And I think that even in the last 4 or 5 years, like before these operational guidelines started being developed, you saw a lot of countries where there was a single transfer value for sectoral cash for nutrition, whereas you really need separate ones, like giving a transportation stipend is very, very different than trying to meet a nutrition gap in the diet of a pregnant for breastfeeding woman or girl. So I think that really working out the details at a country level of what each of those use cases are and what the individual transfer values need to be for that has been incredibly helpful for the countries that are using these modalities quite extensively. So there's a lot of progress there. It also is very useful for evidence generation to understand what is actually the directional change that happens when you provide a transfer for a specific purpose. The third area is that I think it has been a real boon to these conversations with the update of the WHO wasting guidelines, that there is a great allowance and encouragement within those guidelines, both for the use of markets-based solutions for prevention programming, prevention of wasting, as well as for the management of moderate acute malnutrition in situations where those children are not at high risk. And so I think that has emboldened the community of thinkers around cash and vouchers to be able to explore that space a little bit more and consider, the use of markets-based solutions for those issues as well, whereas previously it was more like prevention focused only. So those are three things that I see as big developments, exciting areas of interest for our community right now. Over.
Thank you very much, Maggie. I just would like to come back on this use case. It was mentioned by Pierluigi as an introduction, the 5 different use cases or approaches using both for prevention and or treatment. And we just had a presentation from the nutrition cluster for Myanmar on using CVA for the support of management of wasting. So my next question is for Annalise. What do you see? What are your view on using CVA instead of in-kind SNF? In this case, it would have been Plumpy Nut, Plumpy Sup for the management of wasting or just in general. And when do you think is it the most appropriate? What are the conditions to feed in? But basically, what's your opinion on it? Thank you.
Thanks very much, Diane. And first, a big thank you to the Myanmar team. It was super to hear about the work that they're doing under extraordinarily challenging situations. So certainly very, very interesting. Perhaps my comments are from a nutrition, from a UNICEF perspective. And we have just developed our guidelines for building synergies between nutrition and social protection, including in humanitarian contexts. So my comments are really framed around that. And I do recognize, before I say my comments, that of course we recognize that there are so many diverse contexts and sometimes it's not possible and one has to make very difficult decisions in terms of targeting, etc. But ideally, I think UNICEF sees social protection and cash transfers as one instrument as primarily preventive, and so that we must make that a priority, and that itself is not sufficient to prevent, but that we must leverage the food system and the health system and build synergies between those. So that would be my first point, that we must look at those 3 systems together, and we must take a systems approach to it. That means that we should, whatever we can, if we can, target women in that vulnerable age. So targeting, but pregnant women and children under 2, if possible, all children, if not, priority in poor families, or perhaps in geographic areas. So a sort of universal targeting, potentially a categorical targeting of cash transfers, so that we really reinforce the preventive aspect of cash transfers. My second point is that it's not just enough for cash transfers, and I think this group really understands that, but it's about making sure that we converge interventions with those cash transfers that lead to positive nutrition practices, that lead to nutritious foods being available, and that those same families get access to services. So for me, that's the key question, not what the intervention is. So I know we like to talk about SBC, etc., linking, but SBC for what? It must be around the question of improving practices, improving services, and improving nutritious foods. So the interventions that you combine with cash are going to be different in different contexts. My third point is, and perhaps this relates to Myanmar, that if and where in contexts where there's food and nutrition insecurity, that we do then have to give a top up to those cash transfers. So once you reach that MEB, and I really enjoyed the discussion around the MEB, but often science, that sort of getting that accuracy in these very complex contexts, we might not get it right. And I would argue that we need then a top up for families with children, or a supplementary food blanket across all children, or at least to families who are poor. So my question is really prevention, prevention, prevention. Yes, a top up if possible, for making sure that those nutritious foods are reaching the most vulnerable groups. So I think that we need to be careful of distinguishing between prevention and putting out and making sure that prevention, of course, when prevention doesn't work, we focus on the treatment, and that is a separate question. And then I think we need to look at treatment options, and cash only one option to improve treatment outcomes in a center, in a treatment center. So options could be cash, but it could also be decentralized protocols, strengthening community workforce capacities, strengthening referrals to a social protection system rather than the specific targeting. So in general, we would be cautious about targeting to MAM children, but of course we recognize that in some contexts, because of lack of resources, because of ban of supplies, as I understand it, or basically blockages in the supply line, that these decisions are made under very difficult circumstances. But I'll stop there, Diane.
Thank you very much, Annalise. I think what you just said, Kobe, what was said previously about the importance of targeting, not doing cash for doing cash, but looking at what is a greater outcome. And I think the question of is targeting some children dangerous was one of the question quiz. So we know it's not a full yes, it's not a firm no, but it's proceed with caution. So it's something we have to keep in mind. And we are all aware that the Myanmar context is very specific. And it's all a question about adapting to the context. So my last question will be for Ines. So Ines, just Maggie mentioned about this momentum where everything is coming. People are willing, are interested in doing cash for nutrition, guidelines are coming up, new tools are being available. So what do you think are the past, current challenge nutritionists are facing when using cash for nutrition? Why are they not using it more? Because we do have the evidence that cash has an impact on nutrition where properly designed. So why are we not all doing it?
Thank you, Diane, and thank you for inviting me to this webinar. I think it's a good question, why we're not using it so far, or why we are already using it in some areas, right, in some countries, because I think it's quite timid, but it's something that we are recently using. And I think it's maybe the way we respond, the modalities that we have as part of the humanitarian actors to respond to nutrition. Maybe we don't see this as an opportunity to link with other, like Annalise was talking about social protection, but also with other more holistic. I think Mariana talked about this comprehensive response, multi-sectoral. So I think it's like a perception that under humanitarian settings, we only need to treat and then prevent, because it's sometimes the other way around, even if we say prevent and then treat. So I think we need to shift a little bit about that. First, in the way we respond, to be more efficient, we need to use the cash as one of the modality. I'm not saying is the modality, is one of the modality. It helps because it's a tool that can be adapted to many contexts. So Myanmar context, Ethiopia, but even in a country, they have a lot of different contexts. We have also more and more humanitarian needs and less funding. So that's one of the reasons why maybe we need to adopt new modalities like the cash, right? Cash and voucher assistance for nutrition. We have a lot of challenges to overcome. So I see it like an opportunity. And let me talk more about the opportunities then. Also, it's a way of empower more the women, and how useful is and how central is women for nutrition. So we need to use that like an entry point, not only because they are malnourished, but because they are also the caregivers. They are the ones that need also to have more control on the households or whatever is around, to promote nutrition, if I can say like that. I think on the affected population, it gives more dignity to the community and to the beneficiaries they can take decisions, right? So instead of proposing something that is already tailored and designed from a global perspective or national perspective and tell them this is what you need to do, they can make choices also. So it can accompany and help on the behavior change, but also on the change of small things like going to a health center, for instance. Those small decisions that are not so minimum, they are quite relevant. I think also in terms of working with the local economies as nutrition actors, we need to also go through that. There are several colleagues talking about food systems, but I think the way we need to find local solutions, endogenous community local solutions, cash can be also a good trigger. If we use cash and vouchers for that, they can also multiply the effect of whatever we are doing, right? So for me, those are the things that might be relevant for using more cash for nutrition by humanitarian actors. Thank you.
Thank you very much, Ines. So we are moving on because we are running out of time, but I would really like to thank you very much for your contribution. And as you can see, we are still learning a lot about cash for nutrition, and we need your input on what has yet to be learned, what should we prioritize, etc. So Pierluigi, do you have a last word to say before I hand it to you?
No, I think they were just an interesting question on how from the chat box, maybe we can just briefly mention it and try to answer, and also to our guests. Essentially, they ask how does cash and voucher assistance compare to in-kind food distribution in terms of impact on nutrition. I can try just to say a quick insight from evidence or emergency evidence on cash versus in-kind food distribution. I mean, it's been, I think there is a growing and already solid evidence that cash has a positive impact on increasing food intake. Also a level of outcome indicator. So has been essentially can be effective as in-kind distribution or even sometime more, particularly when there are enough items into the food items into the market. There is also a pretty solid evidence that can be more efficient, so cost less than in-kind distribution, because essentially reduce cost of transporting food items, and also definitely allow much more preference and also dignity of the population that receive it. So this just to say that whenever cash is feasible, can be definitely much more effective and efficient than in-kind food distribution. Yes, that is just, I don't know if there is any of our guests that want to answer also to this or complement this question.
I don't see any Q&A, so I think, Pierluigi, we can move to the priority for 2025.
Yes, so as you can see from the screen, we would like to just check on you very briefly on any priority that you would like to for this group to look at during 2025. You have a QR code here on the screen, or you can just click on the link that I just send in the chat box to answer two questions. One on the thematic contents that you would like us to focus on 2025. Essentially, if there is any topics that you would like the CVA for nutrition technical working group focus on. And secondly, what type of product eventually related to this content you would like us to look at. So for example, you would like more us involved in knowledge development and knowledge dissemination as we have done today with the FAQ and the companion on a nutrition sensitive MAP, or you would like us more to focus on training, help desk. So any of, yeah, it's just for you a space to provide us with some feedback and focus for 2025. To do so, I would like to launch now the Mentimeter. And please, Lani, I think if I be able to share my screen, and doing so. So let me see if I can now connect and show my screen. Yes, maybe. Let me see. Let me see when you see appearing my screen. Do you see my screen appearing? Oh,
not yet.
Okay. Let me just tell me if you see. Just share it. Do you see?
Yes, we can see it now. Thanks.
Oh, okay. So in terms of topics, the first question, yes, please take your time. So some of the things that are popping up are more research and guide, training, scientific evidence, study on CVA effectiveness, guidance tool. Yes, just give 30 seconds more. So we see a lot of issue on, yes, evidence, research, and tools and training. So pretty big spectrum of activity. Okay. Which I think is somehow you are answering also the second question, which maybe I'm not going to launch because, yes, you seem you are touching also the second question, not so much on the topics, but the type of products you want. Okay, no, I think this is well noted. I have 9 people answering. So yes, Diane is yes, training is definitely appearing more and investing in evidence and yeah, support to cluster and some also tools. Okay, great. Yes, I think we will definitely capture those of your yes, needs and suggestion. Yes, we can go back to the slide presentation and maybe just, yes, to have just a reflection together with Diane on conclusion and next step. So yes, yeah, first of all, thanks so much to all the panelists and presenter that has been participated to this session. Just a few words from my side. I mean, maybe just wrapping and summary a bit of what it is emerged today in our conversation. So I think the first main issue, and has been like remarked by different of our panelists, is I mean, we are a cash working group within the global nutrition cluster, but I think it's very right and important to remark that cash is not enough alone to prevent or treat nutrition outcomes. So we are not here to say that is the only solution. I think this is emergent, clear, and also evidence doesn't show it. So cash should be always associated with other nutrition component as SBCC, as link and strengthening of health and nutrition, both preventing and curative service. So I think this is the first key takeaway that I can take from it. The second issue I think is, and we saw during the different presentation, is contextualization. We understand that each context is very typical. We need a solid nutrition and cash feasibility analysis to understand, one, what are the underlying causes of nutrition, two, to understand if cash is appropriate and feasible to address those together with other components. So this is very important. The contextualization, assessment, understanding the context, understanding the drivers of malnutrition, and also understand if some of those are linked to financial gaps from the people that we're serving. The other issue that I would like to highlight is that, and also emerged from the last I think checkout that we have done in Mentimeter, is the importance to build evidence. As we were mentioning at the beginning of this webinar, there is growing evidence in some sector, in some aspect of the application of CVA for nutrition. I mean, we know that there is growing evidence on how CVA together, for example, with SBCC, can somehow support the prevention of malnutrition, how we can also support the access to nutrition service. We have more gaps on, for example, the application and appropriateness on how CVA can contribute on management of wasting. And I want just to remark here some of the activities that our working group is conducting currently in 2024 and will finalizing in 2025, which are, for example, on building evidence, continuing building evidence on the application of cash together with the SBCCC, and also on the use of food voucher for nutritional outcome, but also on the consultancy that we have just launching now on gathering evidence on CVA for management of wasting. And the fourth point is definitely coordination and integration among sectors. So I think moving approach that supports cash plus for nutrition, cash for nutrition outcome, it requires the strength coordination among cash expert, nutrition expert, but also other sectors, for example, food security, social protection colleagues, and also WASH colleagues. I do see the hand of Annalise here. Before we closing out, please, Annalise, if you want to.
Apologies, no, my hand wasn't up. Apologies. Sorry.
Oh, okay. That's fine. Okay, so those are some of my takeaway, and maybe Diane, I give to you the opportunity if you want to just, I don't know, complement some of the issue I just highlighted and close the webinar.
I think, Pierluigi, you did a very great conclusion. I think we are also out of time. Lani, if you can choose, yeah, that's what I was wanting to share. So just to remind people that we can provide support, whether it's one question or to deploy someone. So just reach out to us and we'll be more than happy to provide whatever support you need, whether it's, as I say, you have one specific question on cash for nutrition, or you want to develop your guideline, or you want to have a training, etc. We can discuss it together, so don't hesitate. I think most of the people are leaving now, and again, really thank you very much. We are looking forward to gathering more evidence and sharing them with you next year. So again, thank you very much, and have a nice day, end of afternoon, evening, wherever you are. Thank you.
Thank you. Thanks so much. Thank all the participants. Thank you. Thanks.